Dr. Lubenga. I'm a pediatrician attached to Bungoma Children's Clinic. Bungoma Children's Clinic is purely a pediatric specialty hospital offering wide range of services to children of all ages until with teenagers. We have two pediatricians on board, one who is a neonatologist. So neonatologists are doctors who tend for younger babies, that's below 1 month old. So we have one within the facility. In the hospital, we have a couple of departments. We have the inpatient department that we started most recently. Prior to that, we used to run this as an outpatient center. But now, with evolving standards and needs the community, we are able to have it as inpatient to cater for those children who need more closer monitoring, and also scheduled medications, because previously when you have outpatient, it was difficult for us to achieve that. We still have the outpatient department. We have a full set running laboratory. We have full set pharmacy department with all the drugs, actually all childhood drugs. You can be able to get them within our facility. Our unit also has onboarded several insurance companies. Right now we have a couple of covers, including AAR insurance, which allows us to do both inpatient and outpatient. You can also pick drugs using your insurance, that's AAR. We also have Liaison, which also allows us to have both inpatient and outpatient. So you can come and enjoy amenities at Bungoma Children's Clinic. We also have Britam, which was onboarded to us this year, and which also permits both inpatient and outpatient management. With Britam, you can get all kinds of medicines that you want available. For those special medicines that require prior ordering, you can still come and you liaise with the pharmaceutical department and they're able to do a procurement for those special drugs. This is not limited only to children. You can also provide drugs even for adults, depending on specific needs. So if you have any of those insurance that are mentioned here, you can still come up and do drug top-up for yourself or for your children. We also have insurance like Madison. So Madison insurance allows us for the outpatient department. We still not having the inpatient department for Madison. But we still have other insurances like Kaimosi Friends University, whereby we are able to see all their staff and also their dependents based on their conditions. So as much as Bungoma Children's Clinic is purely established as a pediatric hospital, we still have we have a group of other doctors and staff. So we have 3 qualified doctors on site. We have 2 laboratory technicians. We have 5 nurses on board, and we have we also have other support staff within the hospital so that we can ensure that the comfort of our patients comes first. And so with that, even adults who have got some other conditions, 1 or 2, they can be managed by the other 3 doctors who are available within the hospital. But this is purely a pediatric specialist facility, so that any child, those children who are having chronic diseases like sickle cell, diseases like convulsions or epilepsy, diseases like diabetes in childhood disorders, we also have diseases like heart conditions. We also manage those children with kidney diseases like nephrotic syndrome, who require monthly clinics. We are able to offer all that. We have also scheduled 1 day for adolescents, where we call it the adolescent clinic, where we do counseling. We do all types of counseling for alcohol. We do career counseling. We also do behavioral counseling, depending on how the children are. And so, which we are really trying to encourage most of adolescents. Adolescent medicine is a new concept. We are still encouraging the clinic to grow, so that we have more adolescents coming in, so that we can encourage them even as they go towards teenagehood and also early adulthood, so that they become responsible citizens of the country. So like I said, when you come to Bungoma Children's Clinic, you are assured of getting specialized care. And we also have other collaboration with other institutions, so that you are able to do other tests that are not even done in Bungoma, that we might feel that you require for your child. We also have a developmental department that deals with children with special needs, like Down syndrome. We have also other syndromic children who have got diseases like cerebral palsy, and also those who need other specialized care like speech therapy, those children who are born but unable to speak. So we also do arrangement for them, so that we ensure rehabilitation is done, so that they're able to function independently within the society. Because that's the major aim that we do this. So we encourage all those with children below the age of 18 years to kindly visit us, so that you can have a comprehensive assessment. We also do checkups for them, and also have a package for them. Those who are going to school specifically, to ensure that they're able to function well even within school, because in terms of specialization, that is what we are trained to do. And so Bungoma Children's Clinic has its niche in and around Western Province, being the only pediatric hospital completely set up to offer pediatric services, to ensure that we are the preferred facility within the region, so that we are able to avoid previous referrals that most parents used to go to Eldoret, most parents used to go to Nairobi for their children. So this is the place that you can come in, and we have specialists Monday to Sunday. Each day of the week there's a specialist on board, and so you are always assured that your child will get the highest standards of care possible. Currently, prior to this, we used to operate only for 12 hours, but right now we are now operating 24 hours. So patients can come in at any time of the day, even at night. Nighttime you can have emergencies, children with severe pneumonia, children with asthma. When they get those attacks, please bring them to us. We are able to manage them even at night, and also during daytime. And there are enough personnel available even at night to guide you. We are located on Tronic building. Tronic building is just opposite Easy Coach or Sheriff Center in town, and we are on the 3rd floor. So we currently have an inpatient of 10 beds with 2 private wards, and also general ward capacity of 6. So we encourage those who might require admission services, we are able to offer them, and also those who come for outpatient, then they can still get the quality of care within the facility. Karibuni sana.